Welcome to Cancer 101, the fundamentals of cancer. I worked for the National Cancer Institute for 10 years at the Cancer Information Service, which is the information program of the National Cancer Institute. And so we're health educators and we specialize in cancer, and we help patients and family members mostly understand what's going on with their whole cancer experience. Now during that time, I always tried to bring a bit of reality to the discussion, what I call reality-based cancer information. A lot of times, you can read the dry wording, but there's unsaid things that people just don't quite understand when they're talking to their doctor or oncology nurse. And in particular, chemotherapy is one of these touchy subjects. Now, in my previous 3 videos, I basically talked about the positive reasons that you might want to take chemotherapy. But of course, there are times when you might want to reject or refuse chemotherapy, even if the doctor is offering it. And today, I want to discuss some of those reasons, 3 in particular. The first one is when the chemo is really not expected to do much. You talk to the doctor, and the doctor says, well, yeah, we have some chemo, we can give you some treatment, but if you ask them a little bit more closely, it turns out that the treatment is unlikely to really do any good. Even as a palliative treatment, palliative care, therapy is where you are just receiving treatment to try to reduce symptoms and make the patient feel more comfortable. So you might give chemo in order to reduce the size of a tumor that's pressing on a nerve and causing a lot of pain, which is a common cancer situation. And so the chemo will, hopefully kill most or all of that particular tumor that's pressing on a nerve, and then you won't have to rely on heavy-duty narcotics to try to deal with the pain. You might still need some pain management, but it would be much less. The second situation is where the chemo is expected to give you some result, but the results might be modest, and you need to think about whether you want to actually have that treatment, go through those side effects, and whether it's really going to be worth it to you or not. The last situation is where the chemo really should help you. Large, multi-center clinical trials over many years have shown that the treatment is quite effective and is expected to improve your survival quite a bit. And yet you still may want to decline treatment, and we'll talk about the reasons for that. So starting with number 1, a situation where the chemo, according to your doctor, is probably not going to help you very much. And so, of course, you might think, well, why the heck would I take it? Well, typically this is a situation where, unfortunately, your family members are not ready to let go. And they can be well-meaning, your family and friends, and they're trying to be helpful, and they're trying to give you courage to soldier on. But sometimes they just turn out to be a pain in the ass. And you want to let go, you want to die, and you don't want to take any more chemo because, as the doctor clearly explained to you, it's unlikely to do much for you. It's unlikely to help. It almost certainly will not extend your life. And it might not even be effective in terms of palliative treatment or symptom control, dealing with, pain, for instance. So why would you take it? Well, probably the only reason you would take it is because your son is begging you to take it. Mom, you can't give up. That whole idea that if you give up, somehow you're a failure. But you know what? Life ends. That's just the way life is. Life begins and life ends. So at the end of your life, I would really encourage you to live life the way you want to live it. And many patients want to live it without all that additional intervention. They don't want to be in a hospital. They don't want to be receiving chemotherapy that's making them nauseous and causing them to vomit, that's creating extreme fatigue. They want to be able to spend their time with their family, talking to them, fairly, lucid and not dealing with terrible side effects where they just don't want to talk to anyone. They want to be able to have some quality time, as they call it, with their family members and maybe a few very close friends. And so it's a tough decision, and at the end of this video I'm going to talk about how you can win this battle against your family who's trying to force you to take chemotherapy. And basically what I'm suggesting is you're going to get some help from people who will help intervene on your behalf. Okay, let's talk about the second situation. Let's say the doctor says small studies have shown that there's a modest effect. Maybe the median survival time is improved by 20%. So instead of a certain number of patients living, half the patients living 5 years, maybe there's a few more patients that will live past that 5-year mark. Now, you may decide that it's just not worth it. For 20%, I might possibly get 20%. Of course, that's not guaranteed. That's just based on the studies that they've done. The doctor mentioned that these were small trials. In other words, how much can you trust them? Obviously, a bigger multi-center trial is going to be more accurate or more trustworthy, the results, than, say, a couple of small trials. And so this is another situation where you need to question your doctor carefully and say, please explain to me exactly what you mean when you say it. The results have shown this or that or the other thing. And then make your decision based on that. Is it really worth putting up with 6 months of chemotherapy with only the hope of getting a modest survival improvement? Maybe it is for you, maybe it isn't for other people, but that's what you need to think about. Now, the third situation is that the chemo really should help. In other words, based on many, many trials over years and years, large trials involving large numbers of patients that are in similar situations to you. The trials have been carried out in many different centers, cancer centers like maybe NCI-designated comprehensive cancer centers, which are the largest cancer centers in the country. Maybe they've shown that you can increase your 5-year survival rate by 50%. You have 50% better chance of surviving 5 years than if you don't take the chemo. Now, a lot of people would jump at that and say, that's pretty reasonable. I'm going to go for that. But you might be a person who's been through a lot of treatment already. You might be 85 years old, and already in the past 10 years you've been thinking, okay, well, enough already. I've lived long enough. There are people like that. They don't necessarily want to live forever. And so if you're one of those people, you may say, yeah, okay, maybe the chemo would help. Maybe it would lengthen my lifespan. But at what cost? All those side effects, in particular fatigue, nausea, and vomiting that everyone worries about. And even though the doctor has good medicines nowadays called antiemetics to deal with the nausea and vomiting, so that's less of a concern than it used to be. But at some point, you may have decided, I'm really done. I've had enough. I've lived a good life. I'm 85 years old, and why live an extra 6 months if I have to put up with these terrible symptoms, or maybe you're in a lot of pain, or maybe you're suffering from terrible fatigue, these kinds of things. So that's a completely reasonable decision. But discuss it with your doctor. Tell him flat out what you're thinking. Tell him, you know what, doc, I've had enough. I'm tired. I want to check out at this point. And bringing me a few extra months of survival, I'm not interested in that. And here's the thing, ask the doctor for his support, especially with your family. Ask the doctor to help you intervene with your family so that they accept your decision. Because this is a tough one. The chemo is expected to help you. It's got pretty significant numbers there showing that it could help you. And yet you still want to refuse it. So you might get a lot of trouble from your family and friends. about making that decision. But in the end, it's your decision, it's your life, and your doctor can help you with that. Okay, and that's the last subject I want to discuss, and that is how do you get help on fighting your family once you've made a decision? And sometimes it comes down to that. It almost feels like a fight, because even though your family is well-meaning, you know, they're just really not listening to you and what it is you want. Well, the first thing you can do is talk to your oncologist and say, hey, my family's fighting me on this. Will you please give me some help on this? I really need some help. Tell them to back off. Tell them you've made your decision. Tell them that you, the doctor, also agree with the patient that that's a correct decision for this situation, and you want them to back off, however you can do it. Now, the problem with an oncologist is they're often extremely busy, and you know, how much time are they going to have with your family? Probably not much, probably a matter of minutes, and the doctor will try to state your case and say, you know what, she's made her decision, I think it's a reasonable decision, will you guys please back off? Please don't give her grief about it. So there's probably better people to help you, but certainly ask your doctor. Other people would be, for instance, if you're a large comprehensive cancer center, they may have an oncology social worker, okay? And these are social workers that work just with the cancer patients, and they will give you all kinds of help. You know, financial, they'll help you find people that take care of you at home if that's what's needed, you know, if you're heading home from the hospital, with a wide range of things. But one of the things you can ask them is say, look, you know, Mr. and Mrs. Social Worker, I really need help with my family. They are just driving me crazy. I've made my decision and they keep fighting me on it. They won't let go. I just want to, you know, live out my final days in peace without arguing with my family every day. After all, you don't have a lot of strength. You don't feel well. You're in pain. You're fatigued. It's pretty hard to fight healthy young people like your, you know, daughter or son who are demanding that you take chemotherapy. So you need help. So go to an oncology social worker, or the oncology nurse maybe that you've been dealing with. The oncology nurse might be helpful. And then if you're in a smaller hospital or, you know, cancer center, they may not have a specific oncology social worker, but they often have medical social workers, and they deal with all kinds of patients and all kinds of situations. And one of the main things they do is try to help the patient deal with all aspects of their health situation, all, you know, kind of personal aspects and medical aspects, but in this case, help you deal with your family and help them come over time to an understanding that they're really doing you a disservice by demanding that you do this, that, or the other thing. After all, that's your decision to make. And if it's your time to die and that's what you want, then I would encourage you to get some help and try to stick to your guns and live out the remainder of your life the way you want to live out the remainder of your life. So I hope you find these thoughts helpful. If you liked this video, please click like, and if you haven't subscribed, I would really appreciate it if you would. Thanks again, and I'll see you in the next video.